Good afternoon and welcome to the Schools of Substance webinar on helping schools find and deliver alcohol and drug prevention programs that work. I'd like to begin by acknowledging the traditional custodians of the land on which we meet. I'm joining you today from the Eora Nation, also known as Sydney, a place I was born, raised and have lived for most of my life, a place that is the traditional land of the Gadigal people. I'd like to pay my respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander people who may be joining us online. We'll be recording today's webinar and we'll send a link out to all registrants after the webinar. Schools of Substance team are Australia's leading experts in school-based drug prevention programs with an emphasis on evidence-based programs. Together, our team has more than 30 years in academia, industry, technology, and education. I'm Risha, Operations Manager at the OurFutures Institute, one of the partners in the Schools of Substance program. Today, we have on our panel Dr. Richard Cash, a psychologist who has been working in the field of alcohol and other drug responses for 20 years, Professor Nicola Newton, a Director of Prevention at the Matilda Centre for Mental Health and Substance Use at the University of Sydney, and Ken Wallace, the CEO of OurFutures Institute, who has over 20 years experience in technology organisations, particularly education technology companies. They're part of a team of experts in school-based prevention, education and policy. So I'd now like to pass on to our first presenter, Dr. Richard Cash.
Thanks so much, Risha. And it's always hard in a webinar because you can't see the attendees, but I'm going to assume there's hundreds of people. Big thanks to everyone who's come for giving up your time. This is something we're pretty passionate about and probably love to do the kind of academic trick of saying, well, you might think that drug and alcohol programs are pretty ineffective, but the reality is most of them aren't. And this contains some really well-known programs like Life Education, the Harold the Giraffe version, and DARE, the American program that's been likened to the kind of scaring people straight approach. So these drug and alcohol programs can look great on the surface, but they can have some counterintuitive outcomes. And in fact, some of them actually have bad outcomes, like increasing student interest in drug and alcohol use. Importantly, those programs that include an element of fear don't work, including the subtle kind of fear where you have a uniformed police person deliver the program, or whether you have people with lived experience sharing confronting stories to discourage experimentation. So thankfully, Professors Lee and Newton have scoured the literature and found a couple of programs that actually do work. So the good news is we can help incorporate effective methods into your school. And we understand that schools don't often have the time to interrogate the health literature, find out kind of what works. You do get some guidance from your education departments, but often that guidance isn't tailored to the kind of context of your work, the communities and the students that you're responding to. So we're thinking today about catering to a range of needs that schools might have. A couple of slides on, Risha, if you wouldn't mind. And so this is kind of an idea of some of the things that schools of substance might be able to do. We think schools often need practical advice about their policies or their resources or the support frameworks that they have in place for students. Schools might need help implementing that stuff or thinking about change management, the implications of introducing new programs across a curricula or across a school community. Schools need access to resources and programs that actually do work. And that's the heart of what Nicola and Ken will be talking to you about later in the presentation today. Sometimes schools want training for teachers, for wellbeing providers, or they want to facilitate access to good information for parents. And sometimes schools might be interested in evaluating the impact of a new policy or a new program, seeing whether it's actually having an impact on learning outcomes or wellbeing outcomes or management of risks and harms. So I'm about to hand over to Nicola. I'll be brief here, but we also think the access needs to be easy. So we are keen to provide services in person, coming out and working directly with schools or the school community. Thanks to COVID, everyone's probably a little bit better at accessing programs online now. This is something that we can facilitate, the kind of live but online. And there's some fantastic programs we'll be talking today that are really about self-paced online access to great information and resources. So without further ado, I'm going to hand over to Professor Nicola Newton now to introduce these effective programs for young people.
Thank you so much, Richard, and thanks everyone for being here today. So I'm going to give you a bit of an overview of 3 of the most effective alcohol and other drug prevention programs, not only in Australia, but worldwide. So the first is OurFutures, and these are programs that have been developed in Australia, and they're delivered to an entire school year group or an entire school as such. They're award-winning evidence-based programs on alcohol, cannabis, MDMA, other illicit drugs, and we've also got a couple of programs in development on vaping and for Aboriginal and Torres Strait Islander students. The second program I'm going to talk about is Preventure. So this is different in that it is delivered only to students who are at high risk of developing substance use in the future. So we pull out kids from class and we do some workshops with them. And the final one is the Illicit Project. So the Illicit Project is a neuroscience-based and harm reduction program for our older adolescents, because we're seeing different shifts in drug and alcohol use and the uptake of drug and alcohol use. So it's really important that we also focus on those older adolescents that have traditionally been left without this sort of education. Next slide. Thanks, Risha. So when we're talking about universal prevention, so this is delivered to whole groups, so regardless of their level of risk for drug use. And these are the most commonly types of interventions that are delivered in schools, mainly because they're extremely easy to fit within the syllabus. So OurFutures was previously known as Climate Schools. They're universal e-health programs that follow lives of cartoons, teenagers their age, but through a cartoon scenario. And in that way, it's really engaging for students and teachers to learn about the ins and outs of drug use, laws, prevalence and harms. All the programs are based on effective principles of drug prevention, both the Australian principles and also those principles internationally. And they're embedded within the school health curriculum. So instead of having to teach extra lessons, they fit right within the health and physical education curriculums. And importantly, they overcome the barriers to implementation that we so often see. So the internet-based delivery allows that core components and the core content to be delivered in its entirety, thereby increasing implementation fidelity. Next slide, Risha. Thank you. So the OurFutures programs have undergone an extensive research program and have an extensive evidence base behind them. In Australia, we've conducted 8 large randomised control trials. So a randomised control trial is the gold standard for establishing the evidence behind an intervention or a drug. And we've run these trials with over 21,000 students across Australia. We've also, we have published 55 papers reporting on the effectiveness of the programs. And what these trials have found is that time and time again, those students who receive the program compared to those who receive their drug education as usual as part of their health curriculum have improved alcohol and drug-related knowledge, reduced consumption of alcohol and other illicit drugs, reduced alcohol-related harms, and most importantly, these findings have been sustained for up to 7 years post-intervention. So we're talking about implementing something when students are 13 years old or in year 8, and then they're showing that these effects are sustained, not only sustained, but even get stronger into early adulthood when they're 20, 21, and they're readily exposed to alcohol particularly, but also other illicit drugs. Next slide. So now turning to Preventure. So this is a very different program. It's a face-to-face program, but it's also extremely brief and an extremely fun program to be involved with. It's delivered by trained facilitators and co-facilitators, and these can be educators, psychologists, anyone who's gone through the training. And they're based on motivational interviewing and cognitive behavioural techniques. And what this program does is it targets those personality factors which are associated with future substance use and psychopathology. So there's 4 different personality factors that are extremely predictive of substance use. And in fact, the literature has showed us that these personality factors are even stronger predictors of substance use than genetic factors. So the first type is negative thinking. So these are our students who tend to exhibit low mood or have negative beliefs about themselves, the future, and the world around them. Our second type of students are our anxiety-sensitive students. So as well as having that underlying anxiety and worry, they also have the additional fear of anxiety-related physical sensations. Our third are the impulsivity group. And these are our impulsive students who find it really hard to stop and think. They have that rapid decision-making and really poor response inhibition, which you can see that's how it often leads to alcohol and other drug use. And then finally, we have our sensation seekers. So these are students who have an elevated need for stimulation. They get bored extremely easily. They want more thrill in their lives, and they often take risks because of this. Next slide. So the Preventure program was originally developed in Canada with colleagues of ours at the University of Montreal, but it has undergone many trials internationally and in Australia. I first became involved with the program when I was based in London, and we adapted the program for use in the UK and ran some trials there. And then since returning to Australia, we did some trials here as well. And what we found is that students who participated in this 2-session brief intervention had reduced alcohol use and binge drinking. So that's drinking over 5 drinks in one single occasion, reduced alcohol-related harms, both to themselves and from others, and reduced illicit drug use. And again, like the OurFutures programs, these findings have been sustained for up to 7 years post-intervention. So these are 2 programs worldwide that have these sustained effects up to early adulthood. Next slide, please. Okay, and then the third intervention that is part of the Schools of Substance suite is the Illicit Project. So the Illicit Project is a very fun, colourful, interactive program that is really designed for older adolescents. So it has a harm reduction approach to it, a little bit more so than the other 2 programs, but it's extremely engaging, and the graphics and the videos throughout the modules are really well received by both students and teachers. So there's 3 modules. The first one is on alcohol and the growing brain. And the idea behind it is that by teaching young people to have a better relationship with their brain and to understand what drugs do to the developing brain and how the brain actually develops, then we engage them more in delivering the content and getting them to be able to take on those messages and reduce harms from alcohol and other drugs to themselves in their own lives. The second module is focused on illicit drugs, specifically cannabis, MDMA, and it touches on other drugs as well. And then the third module is around mental health and well-being. Next slide, please. And so whilst not undergoing 8 to 10 randomized control trials, the Illicit Project has been through 1 randomized control trial in Australia with almost 1,000 students. And what we've found is that those students who participated in this program had reduced binge drinking and alcohol-related harm, reduced MDMA use, reduced cannabis use, and reduced illicit drug use up to 12 months following that trial. So I'll stop there and I'll hand over to Ken, who's going to give you a deeper dive into the exciting OurFutures programs.
Excuse me. Thanks, Nikki. And yeah, it's great to be part of this webinar today and have a chance to talk about the important work we're all doing. And thanks again, everyone, for giving up your precious time. My name is Ken Wallace. I'm the Chief Executive Officer of OurFutures Institute. We are a not-for-profit and a new, as of beginning of this year, joint venture with the University of Sydney. And our purpose is reducing the harmful use of alcohol and other drugs through efficacy-based education programs to improve mental health in young people, which is a bit of a mouthful. But another way to kind of think about, I guess, where we're at is that, everyone here knows that mental health is a huge crisis and that, alcohol and other drugs play a significant role in that crisis. And we all know that prevention-based education is key and that evidence and efficacy are incredibly important. But I think what most people don't know, and I hope that one of the things you get out of today's webinar, is that Australia is genuinely leading the world in this space. And we've heard from Richard and Nikki already about how we're helping schools and the evidence behind the programs. And this is world-leading research being taken into schools. And I think that's a really important takeaway and learning from today's webinar. For my part of the session, I want to give you a deeper dive into the OurFutures program and hopefully help you get a sense of how and why it works so well. So next slide, please. So we have, 5 education modules or topics that we deliver. All the programs are delivered online to schools. We cover alcohol and cannabis and psychostimulants, MDMA and emerging drugs, and mental health. The different year groups get kind of different topics. So the year 8s are getting alcohol, year 9s are getting alcohol and cannabis, year 10s are getting cannabis and psychostimulants. Each module is roughly 6 lessons. So most schools would run this during a term and have it part of one of the weekly lessons. Next slide, please, Risha. So in each lesson, we've got contains the key storylines. So these are illustrated stories that follow characters who are the same age group as the students as they face mental health issues, as well as harms and risks around alcohol and other drugs. So there's a social influence factor happening here. So students are getting the learning from characters just like them. And like Richard said, not a policeman in uniform or other people. It's very much around who they are and characters like them. And in addition to these storylines, there's interactive exercises and homework sheets and other activities that the class do together. So the online story goes for about 20 minutes within the lesson, and then the rest of the lesson is taken up with some group activities. Next slide, please. And this is an example of the alcohol and cannabis module. So on the left is, you can't really see it there, but it's a dashboard where students can navigate to the correct lessons and teachers can log in. They can see progress where the students are and mark any homework and that kind of stuff. So there's a whole portal there for the delivery component. And on the right are some pages from this illustrated story. And an example of one is right on the top right there. There's a scene with a paramedic where the learning in that scene is all about what to do in emergency. And that's another key differentiator with the content, that it focuses on harm minimization as opposed to just say no to drugs, right? Which doesn't work. So it's this social influence and harm minimization approach that really contribute to the efficacy of the programs. Next slide, please, Risha. So we've already mentioned, Nikki's mentioned some of the results, but just to reiterate, we're impacting behaviour in many areas around knowledge and awareness, and as Nikki pointed out, around actual usage and also intention to use. So next slide, please. And there's lots of papers, lots of research, but the data on the right is really, really important. So if we were to deliver this content to or 1.5 million high school students in Australia, we'd have 120,000 fewer adolescents binge drinking per year and 1,000 fewer hospitalizations, and making our way to an 80% reduction in harmful drug and alcohol usage. So there's a real impact we can have on society if we can get kind of national exposure to this content. So that's what the Institute's all about, is how do we help schools become aware of what we're doing and how do we help them implement. We're very early, I guess, in this journey, long way to go, but we're really excited about helping schools. Next slide, please. And then vaping. So some of you joining the webinar may have met with Risha and I on the many conferences we've been doing lately. And one of the things that we keep hearing from educators is how big the vaping issue is in school. This is a new program that we've got in the trial phase, and we have 42 schools participating in the trial. It'll involve some baseline data and then schools going into control groups and intervention groups, and then we'll be reviewing the data post-collection and then assessing the impact of that learning and whether there's efficacy, and whether knowledge around vaping has changed, or usage or intention to use. And look, these programs, as you can imagine, take many years to build and years for the evidence collection and peer reviews before they're ready for schools to use. And that's with all those modules that we've currently got, alcohol and cannabis. There's years of research that goes into it before the Institute takes them to schools. And look, it's a bit of a shout out to the university, actually, because it's incredible that we're in the collection phase of this, given how quickly vaping's become an issue. So there's been some serious foresight from the team to recognise that this was going to be a big problem, and they started this process many years ago. So it's great that we've well, it's not great that it's a huge issue. It's a huge issue, but it's great that we've got something that we might be able to support schools with. Using a really similar methodology as far as like cartoon stories and harm minimization. So using the same methodology, there's I guess hope and confidence that there'll be some efficacy out of the program. And if there is, we will likely have some early access that we can provide some schools towards the back half of 2024. But being part of the webinar, we'll be able to keep you up to date on that and keep you informed of how we're going. So that's it from me.
Okay, thanks, Ken. I'm sure there'll be a lot of schools out there eagerly awaiting the release of a new vaping module, given how much of a challenge that's been for schools. Finally, if you'd like to contact us or talk to us about what would work for your school, these are our details. Now we've got a bit of time for Q&A, so please pop your questions in the chat, and in the meantime I've got a few that have been sent in prior to this webinar, which I'll read out. There's actually been a question in the chat, which is what are the costs of the program? So I'll let you each of you speak to those if you'd like to do that.
Who's first?
Well, I was going to say there are multiple programs in here, folks. So at the risk of being really annoying and saying it depends, we do have a kind of a range of different, I hate this word, but sort of price points, I guess. And probably the best advice around pricing is to get in contact with us and let us, I guess, have a conversation about what you need. But we're reasonably sure we've got something pretty affordable within those spectrum of reasonably high intensity interventions, something like Preventure, for example, or working directly with schools, all the way through to really affordable web access programs.
We've had another one as well, which is, are these programs suitable for additional needs students? And I
sure.
Would you, Nikki,
yep.
Sorry.
Oh, sorry. Yeah. I'll just jump in on that. I guess yes, definitely in terms of the main policy type work as well that 360 Edge are offering. But for the specific intervention programs, we have done research. We have included schools with higher needs in our research trials, and we just work with them a bit more one-on-one, but there's definitely a way that we can work with you and find ways to help your students as well.
So I'll go back to the questions that were sent in earlier. So Nikki, how can I stay up to date on best practice in drug and alcohol interventions? Are there any resources you would recommend?
Yeah, so I think from all of my knowledge, the 3 programs that we've described to you today are the most up-to-date, evidence-based and effective programs that we have. But if you're interested in what else is out there and the evidence behind them, Positive Choices is a fantastic website. It's a national website that summarises all drug education across Australia and has different evidence ratings. And I'll just actually add to the open Q&A question as well, Risha, while I'm on,
Sure.
because it's one around prevention training. So Pauline, hi. Yes, the facilitated training for prevention is both online and in person. It used to all be in person, but since COVID, we've found a way to do it online. So please reach out and we can organise that. We have standard sessions throughout the year, but we can also do specific sessions as part of Schools of Substance for you guys.
We've just had another question, which is, do you often experience any reluctance from parents?
In terms of the trials, very, very rarely. So we've had tens of thousands of students gone through these trials, rather than any reluctance from parents for the content. The only reluctance we have seemed to ever get from parents, which is a handful, is around the questions that we're asking in the surveys as part of our research trials. So that's where we have come up a couple of times with some tricky conversations, but we've always managed to get through them. Yeah.
And so Climate Schools is now called OurFutures. And someone else has asked a question about how does 360 Edge compare with OurFutures content? We've used Climate Schools in the past with good success, or are they the same thing? And I'll let Richard, would you like to?
I'm happy to jump in there. Yeah, they are kind of, other than the fact that they're new and shiny and continually being updated, which I think is worth mentioning here as well, that these aren't static programs, but we draw on them and we make use of them. I think the stuff that 360 is doing is the tailoring. Those programs are fantastic, but there are often needs around the programs. So I'm thinking particularly about parent education, teacher or school workforce capacity, and thinking practically about, okay, well, students have got a much better grasp on the issue, but how do we respond as a school to the pointy end of responding to incidents and looking at policies? And I think, to echo what Ken said, the classic one at the moment would be, do we send kids home from camp when they've been caught vaping?
Yeah, I guess the correct me if I'm wrong, Richard, the kind of the audience for OurFutures is very much the students, and the audience for the 360 program is very much the everyone around the students, teachers,
couldn't have put it better,
educators, right? So that's the way to view the kind of key difference between the two programs.
Well said, Ken.
Which leads me to my question for Richard. What does a typical engagement with a school look like with the Schools of Substance program and the in-school component specifically?
Yeah, and again, it's maybe a bit of a vacillation, how long is a piece of string response there, Risha, but we always start with some form of needs assessment, and that can just be a conversation with the people in the school or at the know, or sometimes it is a bit more involved in terms of looking at student needs and community needs and the kind of context of the profile of challenges essentially that the school is facing. That tends to determine then where the resources are best placed in terms of who needs support and how we can help.
Okay. Someone else has asked a question. I recall for OurFutures, students needed to register individually. Is this still the case, or can a school register and use as needed? Ken, I guess over to you.
It's a mixed bag answer there. So we do have schools students individually registering. We do have single sign-on going live, so we can integrate with schools collectively, so students kind of log in and consume the content. Some schools, although it's licensed by student, they may have the teacher just use it and present it, so they all kind of consume the content at the same time together. So there's kind of a few little answers there. So the vast majority, I would say, are registering students individually, and we've got some schools moving on to single sign-on at the moment.
Okay. I've got a question about what support do you have for teachers looking to implement OurFutures, Ken?
Yeah, well, so we try and embody the kind of Apple philosophy of it should be really self-evident what to do. We do have a support team, so if you do need any help around registering or logging in, but it's very simple for schools to get us set up and upload students and get started. So it's a pretty simple platform. But yeah, if you do need help, we're always around via email or phone to make sure that that there's no hiccups along the way.
Yep. And just the final question, I think Nikki may be responding already in the chat. Someone asked is there any research to suggest that speaking about alcohol and other drugs in a harm minimization approach can increase use in some students that weren't using previously? And I think that was mentioned as well by Richard in his talk. So
yeah.
Did you want to
So I've just written
about that, Nikki?
Thanks, Risha. I've just written a couple of notes there. So this used to be a traditional view, and this is why there used to be such an abstinence-based approach to harm, to drug education. And we still see this in places like the US, who have the DARE program and just say no to drugs. But what we've found is, in fact, those programs that do take on a harm minimization approach and talk about harm reduction are not only able to prevent the uptake or the initial use of alcohol and other drugs amongst those who aren't using or haven't been exposed, but we're able to do that as well as to reduce the use in those students who have already been exposed. So as well as being more effective, it's also more relatable and much more acceptable and believable to the schools and students involved as well. So yeah, harm reduction, harm minimization messaging does work in drug education.
Okay, thank you so much. And I've just realised we're up for time now. So if you have any other questions, please feel free to reach out on the details that they're on the screen. And yeah, thank you so much for joining today. And I hope you've enjoyed this session.